Okay. Well, good afternoon, everyone. Thank you for coming. I'm here today with Commissioner of Public Health, Robbie Goldstein, alongside Dr. Alexei Araz-Boudreau, who is the Division Chief of Pediatric Primary Care at Mass General Hospital. Also joining us will be Dr. Sarah Toomey, a leading pediatrician from Boston Children's Hospital. We're here today to share some updates on Massachusetts' continued leadership in public health and vaccine access. Tomorrow in Washington, the Advisory Committee on Immunization Practices, ACIP, begins a two-day meeting to vote on recommendations for MMRV, measles, mumps, rubella, and chickenpox, hepatitis B, and COVID vaccines. So that's tomorrow. We know that the Advisory Committee on Immunization Practices begins a meeting in DC for 2 days to discuss these various vaccines, including COVID, hepatitis B, and your measles, mumps, rubella, and chickenpox vaccines. They will be voting on recommendations. This is the panel that RFK Jr. recently purged of its entire expert membership and replaced with his own handpicked people, many of whom share his anti-vaccine, anti-science views. We hope, nevertheless, that they do the right thing the next 2 days and follow the science, and I urge them to do so. It is concerning, however, that just this morning, the previous CDC director testified that she was fired by Kennedy for refusing to approve sight unseen, science unseen, this new panel's recommendations before they're even issued. Some of you may have followed that testimony this morning in Congress. But I am here today to say that whatever happens in Washington, Massachusetts is going to make sure that we are providing and protecting for your public health. We will make sure that vaccines are available to people in Massachusetts. So today we're taking further action to ensure that all Massachusetts residents have the ability to get the vaccines that they want and need for themselves and for their children and for vulnerable family members. This morning, our Commissioner of Public Health, Dr. Robbie Goldstein, issued COVID vaccine guidance. These recommendations are informed by medical experts. They're aligned with the Northeast Public Health Collaborative that we're a leading member of. And we're making sure that public health is backed by science here in Massachusetts. We're also making sure that all medically recommended vaccines are available in Massachusetts. Earlier this month, Commissioner Goldstein wrote a standing COVID vaccine prescription for every eligible person in this state. We also made sure that insurance plans would cover vaccines at no cost and that pharmacists and pharmacies were ready to distribute COVID vaccines. Today, we're also making sure that your local boards of health in our cities and towns are able to give out recommended vaccines as well. So bottom line, in Massachusetts, if you want a vaccine, you'll get a vaccine. This is true for flu and COVID vaccines. It's also true of children's vaccines, including measles and chickenpox. And it's true of every science-backed vaccine that our public health experts recommend, and it will stay that way. We're the healthcare leader in this country, and we're not going to let Donald Trump or RFK Jr. stand between patients and the care that they need and want. I'd now like to invite Commissioner Goldstein to say a little bit more about these recommendations.
Thank you. Thank you very much, Governor. Good afternoon, everyone. I want to start by expressing my gratitude to the Governor for her commitment to science and her unwavering support for public health. To share with you what we're doing today, earlier this morning, the Department of Public Health posted COVID-19 vaccine recommendations for the 2025-2026 season. These recommendations come with supporting statements from the Northeast Public Health Collaborative and also are backed by the professional societies across this country. Those recommendations say that everyone in Massachusetts is recommended to have a vaccine if they are 6 months of age and older. They place specific emphasis on those who are at higher risk for severe disease from COVID-19, including those who are 0 to 23 months of age, those who are 65 and older, those who have underlying medical conditions that put them at higher risk, and those who live or work in an area of high-risk exposure. Some may say that what we've done today is a new process, but I think what we've posted today on our website and the process that we used over the past few weeks is actually the established process and the correct process. We got here by looking at data. We looked at data from across the country, understanding the risk of COVID-19, the safety of the vaccines for COVID-19, the benefit of those vaccines. We looked at data from Massachusetts to understand which populations are at greatest risk and how we can protect those individuals. We looked to the professional societies, the American Academy of Pediatricians, the American College of Obstetricians and Gynecologists, and the American Academy of Family Physicians. And we looked to public health leaders across the region in the Northeast Public Health Collaborative. Together, we came up with unified recommendations and recommendations that will protect people from COVID-19. I want to say that I come to these recommendations and we're putting these recommendations out. I come as the Commissioner of the Department of Public Health, entrusted with the responsibility to protect the health and well-being of everyone in this Commonwealth. But I also come to these recommendations as a former advisor at the Centers for Disease Control and Prevention, someone who watched nearly every ACIP meeting throughout the COVID-19 pandemic, someone who was engaged in the process to evaluate the data, understand the safety and the effectiveness. But I also come as an infectious disease physician, someone who worked in the hospital during the COVID-19 pandemic, who sat at the bedside in the ICU of individuals who couldn't access or benefit from the COVID-19 vaccine, and someone who sat in a clinic room and discussed the risks and benefits with individuals. What I want everyone to take from this is to understand that there was a process to come to these recommendations. It's a process backed by science and evidence. It's a process that should be trusted, and a process that we're putting out transparently. If you go to our website, you can see our recommendations. You can see the data that those recommendations are based on. You can see the collaboration across the Northeast region. And with that, I will pass it back to the Governor for additional remarks.
Yeah. Thanks so much, Commissioner Goldstein, Dr. Goldstein. And, you know, we're very lucky to have you on the job here in Massachusetts at this time when, frankly, states are having to step forward and fill the void left by the total abdication of responsibility by the federal government. That's what's happening here, to be clear. And so I just really, really appreciate your background and your comments and the way that DPH has responded so quickly in this moment. We also have two physicians with us, pediatric physicians. Thank you, Dr. Toomey, and thank you very much, Dr. Aras Boudreau, for being here today. And I invite you to offer your words, if you would, about recommendations and these vaccines. Because look, it's important to me, okay? I'm a parent, I'm a daughter, I got people in my life who are vulnerable. We all have people in our lives who are vulnerable. We want to make sure that they have accurate information, that they have science-backed information, and that they're getting the word from medical experts, okay? That's what this is about, and that's why I wanted to make sure that we were making vaccines available to those who want and who need them without further delay and at no cost. And so I thought you could hear directly from people who are actually in the business of administering vaccines.
I mean, I think the first thing I'd like to say is thank you to the governor, thank you to the commissioner for taking bold action. Last respiratory season, there were 44 pediatric deaths due to COVID. 4 of them were in the state of Massachusetts. When vaccines are so safe and effective, that is one too many. As a mother of 3, I make sure that my daughters, each respiratory season, are fully vaccinated. I really appreciate the fact, as a mom and as a pediatrician, that I can now offer those vaccines again to any of my patients and to my own children. Thank you.
Thank you. Thank you, Doctor.
Thank you for asking us to come. I do think this is extremely important issue. As a pediatrician, mother, and as the chief safety and quality officer at Boston Children's, I just want to say what we know is that there is a long history of vaccines being safe and effective. And more than that, as Alexi just responded to, is that what we know is that vaccines protect our children, our families, and our communities from very serious disease. This really is extraordinarily important that people continue to get vaccinated, continue to follow the science. And I'm just grateful to be living in Massachusetts, where it's clear that we are committed to doing what's best for our children and for our communities.
Thank you both very much. We're happy to take any questions. We'll start on topic.
You said, Doctor, you said 4 pediatric deaths due to COVID in Massachusetts. And out of how many in the country?
44.
Out of 44. So why is it higher relative to, shouldn't it be like 2%? Why do you believe it was so much higher? And then if I could, why these recommendations for 6 months to 23 months for the children to get the vaccine?
Why don't we start in reverse, if you want, Commissioner Goldstein, on that?
Yeah, I'm happy to start. So on the point about 6 to 23 months of age, I'll just first note that the COVID-19 vaccine approved for children is only approved for 6 months and older. But we do know from the data here in Massachusetts and across the country that children 6 months to 23 months of age carry a significant risk for severe disease from COVID-19, including emergency room presentations and hospitalization. That risk approaches what we see in the older age group, in those that are 55 and older, and in particular, sometimes we see the risk even reaching that for 65 and older. So that's an incredibly vulnerable population in the Commonwealth and across the country. And so it's really important that those young children, those young babies, get the vaccine to protect themselves going into the respiratory virus season.
And I'd also just say, look, these folks are in the business of providing care, and God bless them, okay? They're not going to get into politics and engage in that. And I just appreciate the work you do day in and day out. I also want to say, well, this is an announcement today about COVID, because that's the timing of where we're at. I want you to know, and the reason that I mentioned that RFK is convening his newly configured panel of people for ACIP the next 2 days, they're going to be looking at childhood immunizations. And he's got a team that he has put on that committee who are anti-vaxxers, anti-science. And that's why I am glad to be able to stand before you and represent that we will take whatever steps are necessary to make sure that, for example, parents here in Massachusetts can be confident that the measles, mumps, rubella, the chickenpox, the hepatitis B, these immunizations, which are particularly important for children, will still be made available. Now, I hope it doesn't come to that, because I hope that RFK's panel does the right thing. But suffice to say, I don't have a whole lot of confidence that they're going to, and that is why Commissioner Goldstein and the Department of Public Health are ready to move. This is about making sure that we're protecting public health. I want Massachusetts, everyone in Massachusetts, to have access to the health care that they need.
Governor, are you worried that this precedent that you're setting, this shift away from federal standards, could be misused down the line under a different governor, under a different administration who has different views than yourself? I mean, you're setting Massachusetts apart from the feds and in some respect apart from the rest of the nation.
I didn't start this. The federal government started this. And they started this a while ago with a big, beautiful bill that made substantial cuts to health care in this country. That right now, we're staring down the fact that because of what Donald Trump and Congress did, upwards of 350,000 Bay Staters are going to be thrown off of health insurance, right? We have seen cuts after cut to housing, to food assistance, to heating assistance for seniors. We saw the cuts to the VA for men and women who served our country. So they started this, and because Donald Trump put a conspiracy theorist in charge of HHS, we are where we are, and it's most unfortunate. But they started this by completely dismantling public health in this country, including by firing person after person at the CDC. I mean, you just heard the testimony from Dr. Menards this morning. I mean, so that's what's happened. And in the face of that, it is states who must step forward to ensure that we're doing all that we can to protect the health and the safety and the well-being of our residents. And that's why we're acting. You see other states acting. States are working together. I hope there comes a day where they reverse course and get back to science and get back to medical experts, right? We need a partner in the federal government, but lacking one right now, we need to be able to lead as states, and that's what I am doing, that's what Massachusetts is doing, and that's what we're gonna continue to do as long as we need to take these measures to protect people's health.
Are you consulting with other states as well, other governors?
Oh yeah, as reported, we have been working together for a long time, and I want to credit Commissioner Goldstein, who has really been the leader among this group, working in collaboration and discussion with other states as part of this Northeast Public Health collaboration.
Yeah, I would say that we have broad agreement across the Northeast, and that agreement is both on these recommendations and also on our desire for the federal government to go back to what it was before, to recognize the power of the federal government when it comes to vaccine recommendations and vaccine policy, to understand the history that exists there over 50 years of the federal government leading in vaccine policy. We're all hopeful that we go back there, but in this moment, we just can't trust what's coming out of CDC.
Do you
Governor, you
anticipate?
talked about the ACIP meeting. Are you planning to issue your own guidance on the other vaccines that the ACIP is voting on today?
So just for everyone to know, there are 2 days of this meeting. The first day of the meeting is going to be focused on hepatitis B vaccine in children, and the second day will be on COVID. I should also say the first day will cover the MMRV vaccine, measles, mumps, rubella, and varicella, or chickenpox vaccine. The Department of Public Health is going to review the recommendations that come out of the ACIP meeting, but we've already committed to making sure that we use the exact same process that we used for COVID, to look at the data, to work collaboratively with our other states in the Northeast, to look to the professional societies, and to put out evidence-based recommendations for those vaccines.
Dr. Goldstein, let's say that ACIP does what is predicted, which is they push back Hep B to 4 years versus at birth. If there's somebody who has a baby next week and you have not yet issued your recommendations, what happens to the vaccination for that child? Or somebody who's scheduled for their MMRV vaccine next week? Like, you've issued a standing order for COVID vaccines, would you do something similar to ensure there's a continuity of care? Would there be a gap where people wouldn't be able to get their vaccines?
We'll maintain access for the vaccines here in Massachusetts. There's a lot of hypotheticals in that question. And so with each of those hypotheticals, we'd have to work through a different process. But
how would you, like, again, you did a standing order and said you can get your COVID vaccine. Would you do something similar for these other vaccines?
I think that's one option. There are many options when it comes to those vaccines. A lot depends on how ACIP acts, the votes that they take, and specifically how it interacts with the Vaccines for Children program. We're going to learn a lot tomorrow. I think it's going to be a really interesting meeting. I'd encourage everyone to listen in.
Governor, as you think about childhood immunizations, some of our neighboring states have removed their religious exemptions for schools. Is that a step you think Massachusetts should take as well?
I'm going to be guided by medical experts and pediatricians, I mean, I think that childhood immunizations have been part of what we do in this country, and I think they've proven to be to great success. I mean, was a polio vaccine discovered here? Yeah, at Children's Hospital, and I grew up, I didn't know of polio, right? There's a reason for that, and so I think, the idea that the MMRV vaccine would go away, or that, other vaccines would go away that have proven their efficacy, didn't hear from me, you heard it from the experts. These are good things, and I'm going to continue to be guided by that, as well as guided by our Department of Public Health.
Governor, do you support changing the state flag and seal? Is that something that you think should be done?
The state flag and seal.
Yes.
Look, I don't mean to laugh, but of everything that's going on right now, I support that there was a legislative commission to look at this. I think it's the state seal, the flag, and the motto maybe. So the legislature passed a law, the commission to look at all this, so I think it's have a look at it, and I'm sure there'll be discussion, over the ensuing time and years and an opportunity. I think they make recommendations at some point.
Recommendations out right now, have you seen them?
Okay, but I think there's gonna be more discussion, all that. I mean, honestly, Chris, I'm focused on, a bunch of stuff, public health that we're talking about today, building more homes, driving down housing costs, right? Bringing more energy into the region so we can lower people's energy bills. We've got, ongoing issues with ICE in our communities, right? And, these are the things that I'm focused on. So I appreciate interest or endeavors by others at that look. But until, further discussions and recommendations, I'm looking around behind me because usually oh, there we go. Okay, I'll continue to be here and that flag will continue to be here.
Get back to
Yeah,
vaccines.
yeah.
On the insurance issue, you mentioned that people are covered by their insurance, but it doesn't actually apply to people with self-insured policies, companies that are taking their own insurance. Have you had any conversations with insurers about that population? I think it's about 40% of the state that isn't affected by the mandate.
I've been really pleased to see so many people come forward and so willingly participate in this, our insurers, and also remember Mass Health, GIC, which covers all of our public employees. So, I think that what we've seen is nothing but sort of ready recognition that this is important. It's preventative, right? It's preventative, and I think there's been a great willingness to do that. As to the specifics, I'll have to get back to you on that.
Dr. Goldstein, what would you say to those parents out there who feel like 6 months is too young for a recommendation to have their child vaccinated?
Well, I'm happy to say a few words, but also we have two pediatricians here who I think have that conversation every day with parents about their children. But I would note that vaccines are incredibly safe. And in particular, the COVID-19 vaccine has been studied over the past 4 years now. Over hundreds of millions of doses have been administered. It is an incredibly safe vaccine. But the risk of COVID-19 disease to a child of 6 months of age is really significant. And if we can do anything, if a parent can do anything to protect their child from that disease, I think we should be encouraging that. And that's what this vaccination is.
Do either of our doctors want to say anything about that? Or you said it before.
I just completely agree. It's been shown to be very safe, but I think even more importantly, the smallest children are actually at very high risk for serious disease, and this goes for many of the diseases that we're trying to prevent using vaccines. And so it's actually extraordinarily important that they actually receive the vaccines that we have available.
Is there the damages already been done to some extent, though, in that so many federal public officials who are casting doubt on vaccines, including at today's hearing? I mean, you're trying to maintain access, but is that message going to be received?
Well, the important thing is we're maintaining access, right? I mean, I don't know. Look, in this moment and in this time, when I see funding cut and when I see the action of the Trump administration and Bobby Kennedy 2 weeks ago, effectively taking away vaccine access. I mean, that's what happened, right? I think about, we think about the young kids. I think about cancer patients. I think about senior citizens. I think about people who are immunocompromised. We all know people who fall in those categories. There are many, many, many people in Massachusetts who are vulnerable, who want and need access. So we made that access available. It's as simple as that, okay? It's as simple as that. I'm proud that Massachusetts did that. I'm proud that nothing is standing between somebody in Massachusetts and their desire for a vaccine. That's what this is all about. And so I appreciate the team for operationalizing so quickly. I'm sorry that we had to do it in the first place, that the federal government walked away from their responsibility, but I'm glad that we were able to do it, and I give great credit, to the Massachusetts healthcare system. And I just want to say that again, okay? There is no healthcare system in the entire country like we have in Massachusetts. That's why we're #1 in healthcare, in fact. The system of hospitals and community health centers and providers and medical schools and teaching institutions, it's really amazing. And, as they came together and worked together in COVID, they continue to work together now with our administration in doing what we need to do to make sure that we're able to deliver care. And it's become increasingly hard given the absolutely devastating and misguided cuts by Congress and the Trump administration. In the same way, you know, the defunding of medical research and discovery is so misguided. I mean, who does that? Who kills hope by taking away research funds when people in Massachusetts right now are on the cusp of discovering cures and treatments for ALS and Parkinson and all sorts of cancers, right? But unfortunately, folks, that's the world we're in right now. And in Massachusetts, we're just going to lead and take care of one another and take care of our people. So thank you. Thank you. Thank you. Thank you, guys.